It's a pleasure to open this symposium on long COVID, featuring so many speakers, so well versed in the absolute forefront of current knowledge. They will all speak to different aspects of this new condition, and I will start by giving an overview. So, what is long COVID? To better understand the logic of this condition, it can be helpful to look at the basic pathophysiology of COVID-19, because we now know that the SARS-CoV-2 virus enters the cells of many organs of the body. For many cell types, the virus enters our cells via the ACE2 receptor that are especially abundant in the cells lining the insides of our blood vessels. And you can see those cells here. And of course, they are everywhere in the body. And thus creating inflammation and dysfunction here. But we also find the ACE2 receptor in the cells of the intestines, heart, kidneys, airways, eye, gallbladder, testicles, ovaries, and placenta. So the virus enters cells in all these organs. But in addition, it seems the virus can actually enter several types of immune cells via other receptors. There is some evidence that the virus enters our T cells using the LFA1 receptor, a receptor that the HIV virus also uses to enter these cells. And the virus can enter monocytes and macrophages using the FC receptor, and also our neurons using yet other mechanisms. So when we are infected, the virus can spread throughout the body. And from this, it's not surprising that we can see so many symptoms. More than 200 different symptoms of long COVID have been registered from 10 different organ systems. The SARS-CoV-2 virus affects all the body. COVID-19 is a multi-organ systemic disease, and thus it's not surprising that we can see long-term effects from the whole body. So what causes long COVID? Scientists are finding evidence pointing to viral persistence, that the virus remains over time in compartments in the body, such as the gut. Reactivation of other viruses has also been found to possibly play a role, as may imbalances in the microbiome. And autoimmunity may trigger mechanisms so that the body starts to attack its own cells. We'll hear more about all of this and what this again may lead to later. There is some evidence of different symptom constellations in different groups of patients, and we may find that different manifestations will require different treatment. But from the above, it's also easy to see that you can end up with organ damage that persists after COVID-19, that also can cause ongoing symptoms. For example, it has been shown that there is an increased risk of cardiovascular conditions such as strokes, pulmonary emboli, or heart attacks that last for many months after infections with SARS-CoV-2. The diversity of symptoms and the fact that symptoms may appear after some time adds to the challenge of creating a clear definition to exactly what comprises long COVID. The lack of such universal definition makes it harder to compare different studies and to understand what long COVID is and how large its impact on society. The large number of symptoms has also created challenges for researchers in trying to estimate the prevalence of long COVID. Which symptoms you include in your definition has a lot to say for what results you get. If you ask people about fatigue and fever, but not reduced memory, you will find a lower number of affected people than if you ask about all three symptoms. So, how many go on to experience long-term symptoms? The first estimate from the Office of National Statistics in the UK from October 2020 reported that around 10% went on to develop symptoms that lasted for more than 12 weeks. For a long time, this figure was the most cited for the prevalence of long COVID. However, early in the pandemic, we didn't really know which symptoms we should include. And for this estimate, the ONS only reported 12 different symptoms. So in a large study from the Netherlands that was recently published, we saw a similar setting. Here, they didn't ask for any cognitive or psychiatric symptoms, symptoms that we now know are very prevalent in long COVID. This in itself would lead to a too low estimate. But one strength of this study was the inclusion of a control group, people who hadn't been registered as infected, to compare symptoms between the groups. Without a control group, you might think symptoms that would have been present anyway were due to long COVID. But the study didn't actually test if people included in the control group weren't recently infected too, without being registered. And since the Netherlands has had extremely high levels of infection during this time, it is unfortunately likely that some in the control group also had COVID, especially as they found an unexplained increase in long COVID associated symptoms of 18% in the control group too. So when they report the prevalence as the difference between those two groups, which was 13%, this figure is likely also too low. And all of this illustrates some of the challenges the scientific community are facing in this field. However, in recent months, several large studies with data from many countries around the world seem to converge around similar results. For those with registered infection overall, there seem to be around 1 in 3 that go on to experience long-term symptoms. And for those who have been hospitalized with COVID, around half do not fully recover afterwards. But since most of these studies lack control groups, these figures may not be fully representative either. To add to the complexity, data imply that vaccines may protect against long COVID, but only to some extent. Studies report between 0 and 50% protection from the vaccines. One solid study reported a figure of 15% protection. But then there's also the question of not only whether or not symptoms develop, but also how debilitating they are and whether or not vaccines may protect against the worst symptoms. There is still much we don't know. Also, we now have some data that imply that the risk of long COVID may vary between variants. So far, it may seem that the risk is lower after Omicron infections, but that due to the very high number of infections, the number of people affected continues to rise. In the UK, an estimated 3% of the whole population now report that they have long COVID symptoms. And among these, 1.5 million reported that this adversely affected their day-to-day activities. So, although the spectrum of severity varies greatly, it is becoming clear that quite a number of those suffering from long COVID have a high symptom burden. A large multinational study found that when comparing the average level of disability among long COVID cases with what is known from other conditions, the symptom burden was on average equivalent to the burden of disease for conditions such as severe neck pain, Crohn's disease, and moderately severe traumatic brain injury. So when you combine the great number of affected people with these sort of symptom burdens, you get a situation that very likely will affect both individuals and society in a multitude of ways for many years going forward. Thank you.